Welcome to the Inspired Living with Autoimmunity podcast, the podcast for high achievers who want to stay sharp, focused, and full of energy despite their diagnosis. With your host, National Board Certified Functional Medicine Health Coach, Julie Michelson, where Julie helps you take your power back from autoimmunity. And now here's your host, Julie Michelson.
Welcome back to the Inspired Living with Autoimmunity podcast. I'm your host, Julie Michelson, and today we're joined by Dr. Aumatma, the holistic fertility doctor. Dr. Aumatma supports badass power couples to create the family of their dreams, and she also trains doctors who want to specialize in fertility. In today's conversation, we discuss optimizing conception and pregnancy when you have autoimmunity. Dr. Aumatma gives us simple steps to take and tests to consider to improve outcomes. And even if you aren't planning on having a baby anytime soon, our conversation will help you up-level your health. Dr. Aumatma, welcome to the podcast.
Thank you so much for having me, Julie. I'm excited to be here.
I am so excited as well. I love your work. I love your podcast, and I know listeners are going to get so much value out of this. So let's dig in. For those that are unfamiliar, how did you get to be this fertility expert?
It's actually a funny story because I started as a naturopathic doctor. I was already in practice for quite some time. And I kind of woke up married to this person that I had chosen to marry. And he started talking about having children. And it was the first time that I had even thought of it. Like, it was just not on my radar at all. And I was like, oh, crap, you're right. Like, we should probably be thinking about this. And then I realized my intuition, my uterus, literally everything in my body was like, no. And I was like, what? Is it him? Is it a no period? Like, what are we doing here? And I went kind of into a 9-month rabbit hole of kind of tuning in and trying to figure out, was it that I never wanted to have kids, or was it that I didn't want to have them with him? And what I realized was it was him, that I did not want to have kids with him. But it brought up for me this desire of like, actually, I really want to have a child. And if not with him, then what am I doing? Like, why am I married to him? So it kind of led to a divorce, unfortunately. But that process of like exploring, because what I remembered from medical school was literally your fertility is good till 35, and after that it drops off of a cliff, and good luck for you. And I was like, well, 35 is pretty close. So what are we doing? So I kind of went down the research rabbit hole and realized that a lot of what we have talked about and told and even taught in medical school is based on a lot of myths that are not proven. And as I started talking to people about them, people, like women, kept coming up to me and were like, hey, you can help me with my fertility. And I was like, no, we're just talking myths. And it kind of like evolved to the point where it is now like almost every single one of our clients is a fertility client. And it's become my passion because I feel like there is so little there is so much evidence, and there's so much evidence-based support that we could offer women, but in reality, that's not what's happening most of the time. So I really have tried to walk this line of like, we want to support women, we want to support couples to have healthy babies, but we also want to do it in the context of research-driven and as holistic as we can possibly get. So not like an anti-Western medicine, but how do we integrate, how do we make this work the best for the couple?
Yeah, which is amazing. Oh my gosh. I love your story. I have 3 kids, they're adults, and we just recently had this conversation of, I don't know how to get them to understand, but we were talking about choosing a mate if you want to have a family or you think you may want to have a family, like that should be a criteria of like, this is a person, like I have to have babies with you, right?
Yeah.
Like,
Yeah.
and so I just want to like touch on like how brilliant you are. And all the time I'm talking with my clients and on the podcast about tuning in, right? Tapping into our intuition, listening
Yeah.
to our bodies. You were like, I don't know if it was my uterus or what, what part of me, right? But clearly you were getting the signals, something isn't right here to reproduce right now
Yeah.
with this, in this situation.
Yeah.
And so I love that because it's so important for all of us. And I know that's not what we're going to get into
No,
today.
it's totally fine. I feel like the intuition piece is just so important because even clients that want to work with us, I'm like, I'm not here to sell you on working with us. Like, go tune into your intuition and see if it's the right fit. And if it is, you're pretty much guaranteed to get pregnant.
Yeah,
But if it's not, like you're forcing something that's not tangibly there for you,
right.
then maybe don't do this.
Yeah.
Right?
Well,
So, yeah.
and to touch on the lack of science in all of those myths, right? Because if you think about, studies weren't done with women. So all of this quote unquote medical data wasn't really data,
Mhm.
but I do love, and I had this is the last, then we're going to move forward, I promise. But
Yeah.
I love that your rabbit hole. I so wanted to say, was it 9 months or was it
Yes.
40 weeks? Which
It's
was
pretty
your
much
rabbit
like
hole?
what's really interesting is when I look back at my life, every single thing that I have done has been in like
3
the
trimesters.
3 trimester type uh energy. It's like
I
really
love
bizarre.
that.
Like the big stuff in my life happens over a 9-month period. It's like it has to gestate, it has to grow, it has to like, and then it's like birthed into the world. It's really bizarre, but I feel like that's a really natural process that we often are like trying to rush things, or we're like, oh no, I need to get this out of the door right now. But in reality, like our our phases, the way that even I teach this to practitioners is like the way your business is going to be birthed is going to be the same way that you grow a human in your body and then birth it. And that birthing process might be painful, but
Often.
it needs to have like fully
This beautiful
gestated
thing.
before.
Yeah. I love
Yeah.
that.
Yeah.
And share with listeners so did you miss your window? Was it too late for you to have
No,
children?
I ended up, so I preserved, quote unquote, preserved my fertility. I did all of the things that I figured out to do for other women, and I did them for years, actually. And then finally met my now husband. We even dated for like 4 years before we decided to have a child.
So you weren't in a
And
rush.
yeah, and I was 38 when I had my little one. So
Which is beautiful.
it's yeah, I feel like, it is possible that we choose what it is that we do and like who we reproduce with, uh and if it's like the right time or not the right time. Like there's so many women out there that are asking these questions, and I feel like the go-to answer is, well, freeze your eggs and don't worry about it. And I'm like, yeah, I don't know if that works actually.
Might
So,
not be option number 1. Like,
yeah,
let's not.
yeah, yeah.
That's amazing. So I am guessing that at least a good number of the couples that come to you, at least one of them, and we'll kind of focus on mom, but it
Mhm.
actually, it could be
Could
either
be
way,
either. Yeah.
have autoimmunity or,
Yeah.
inflammatory issues.
Yeah. Yeah, like a very large percentage of them. If we include like generalized inflammation, that's a big percentage of the population that does not know they even have
Yeah. Well, I
inflammation.
look at that as like the beginning of the spectrum, right? Like I
Yes.
really, so, so somebody shows up and, they're like, we want, we're ready. This is the time we want to have our family. And I'll throw Hashimoto's out just because I know there's such a,
Mhm.
but pick any,
Yeah.
and I don't know that it matters.
Yeah. All autoimmune conditions tend to have the same issue, which is it's going to be harder to get pregnant and harder to stay pregnant. And so what's interesting to me is with Hashimoto's or with even like Crohn's disease or lupus, there are a lot of antibodies that are floating around in the system. And it's bad enough that the antibodies are confused and attacking your thyroid, for example. But the same antibodies are then going to potentially attack the embryo that is forming and growing within you. And it's that shift is hard for a lot of people because that's going to lead to a pregnancy loss. And like the way to prevent it is to get at the root, right? So Hashimoto's, and even like dial that back and like, how did that happen?
Right.
Why do you have Hashimoto's? So really kind of dialing it in and getting at the root of the autoimmune will support a healthier pregnancy.
I
And I
love that.
think I think a lot of times in Western medicine, the standard of care is like, oh, we're just going to put you on prednisone, and that's our solution.
Right.
And that is okay if you're like already pregnant and that's your last case, like let's try to do what we can. But if you know that that is the case, then you really have to question whether prednisone is the best approach. And I just talked to someone this week who actually has been on cycling prednisone. So basically, like as soon as she ovulates, they put her on prednisone for 2 weeks, and then she gets off of it for 2 weeks, and then she's back on for 2 weeks and off of it. And I'm like, and how's that working out? And she's like, I feel crazy like all the
You see
time.
my eyes? I'm like,
Yes.
no.
Yeah.
When I was in the decline part of my health journey, my kids, I like to think I was a very calm, I'm not a yeller, very mellow person. Prednisone in my family is called mean mommy medicine because I had no patience. My kids were young. So like, that's why the look on my face, I can't imagine.
Yeah.
And it has a time and a place, to manage symptoms.
Yeah.
But like you said,
It's
if you're managing, so for
yeah.
listeners that are in a place where they're either already trying to conceive, and carry to term, or they're like, okay, I know within the next couple of years, but they haven't started to get to the root cause of what's going on with their autoimmunity. What are their drivers?
Mhm.
It sounds like, that's the place to start, which of course makes me so
Yeah.
happy because this is what I want everybody to be doing anyway. Trying to conceive or not, right?
Right.
Is
Yeah,
like,
absolutely.
let's
Like,
just turn this process around.
yeah, yeah, I think a lot of times it's frustrating because doctors will literally say, "Well, if you have antibodies to your thyroid, there's nothing you can do about it anyway, so just leave it alone." And to me, I'm like, "What?" You know,
No, make them turn off, make them
y-
stop.
I have
They
I have
will.
I
They
have
can.
one patient who I've been working with her for almost 10 years. She's not trying to get pregnant. She's a super young woman. She's actually like working on preserving her fertility and wants to get pregnant in the next few years now. But so 10 years, this woman first walked into, like, we used to have a herbal dispensary, and she walked into this dispensary and she was like, I don't know what to do. My hair's falling out. Like, I have all of these symptoms. I can't swallow. I've been to like 6 different doctors plus the ER, and they found nothing. And I'm looking at her like she has this
You could see her
massive
thyroid.
goiter. Yeah, I'm like, did they test your thyroid? And she's like, what? No, why? And I'm like, let's do some basic tests. And her TPO antibodies were like 780. That's
Oh
kind
my
of the highest
gosh.
I've ever seen in anyone. And she was like, oh my God, you found it. And I'm like, oh no, this is just the beginning. Like, if you have this, then we need to figure out what else is
Why?
happening.
Yeah.
And sure enough, within like a couple of weeks, her antibodies went down, the goiter went down, she was able to swallow again. Like, it just seems crazy to me that 6 different doctors, the ER that has access to so much technology,
Yeah.
and they couldn't like
Run a
see
blood
this
test.
massive goiter in her neck. Like, I don't know, I don't get it. So
That is so crazy. But think about what a blessing for her that, as you said, and that was 10 years ago, but
yeah,
as she's starting to consider that she's almost ready to start a family, she's managed all of that.
yeah,
Because that could be, who knows how many miscarriages she's avoiding
absolutely,
down the road. I
absolutely.
don't know. So,
Yeah,
what are, I would imagine most listeners, and it's probably same for you, are already kind of on that path, right? Of oh, the pups are chiming in. They are looking for root cause or working on root causes. I used to say root cause all the time. I'm like, when is it just one? And it's not. So hopefully they're already taking steps to identify and start to
Mhm,
manage. But
mhm.
and I know there are commonalities.
Yeah, yeah,
So,
absolutely.
is there, if somebody's trying to conceive, is there a particular way of eating or
Yeah,
diet, nutrient, what do you
yeah.
tell people to do?
I think a good general starting point is the AIP diet, and
Okay.
that's the autoimmune protocol diet. The main things on there, it gets very like nitty gritty, but the
It
main
can.
things on there, like avoid gluten, avoid soy, avoid dairy, avoid sugar and corn. Those are the 5 big ones, right? So that helps to at least get to the point of like instant reduction of inflammation, and then we can actually like do some more tests and try to figure out, like, do you have food sensitivities? Is there intestinal permeability issues that are going to then support or make worse the antibodies that your body is creating? So I think that it's a good plug. The AIP is like an instant, like, let's get at this as quickly as we can.
Yes.
And then we can like figure out more details. And I've seen antibodies that people are making because of food sensitivities to like beef, which
Yes.
is
Or
crazy.
spinach,
Or
or,
spinach or
it's,
kale or like all the things
yes.
that you're like, what? We shouldn't be reacting to this, but it really doesn't matter. Like, your body can literally react to any food that you consume.
Well,
But I
and
think the mhm,
once we have leaky gut, I mean, that is what happens. And
mhm,
I love that you're like, start, because I'm an AIP coach. And I used to, when people weren't getting the results I was expecting, then add in food sensitivity tests
mhm,
and focus in more on the gut. And now it's like, no, we just do that up front, because I know if you have autoimmunity, you have leaky gut unless
yeah,
you've already done the work to heal it.
yeah.
I joke, even a few years ago, I did a food sensitivity panel and I was like, oh, there's Wednesday night dinner. It was salmon and broccoli and garlic. And, I was like, yeah, spinach, all the
Right,
things.
right, yeah,
But that's what happens is, once the leaky gut is there, and it is, if you have autoimmunity, you have it. I mean,
yeah,
you have had it. And I love that you clarified too, because people look at AIP and they get so overwhelmed because it is really in depth and intense.
Mhm.
And
And
I
you
love,
honestly, and you need a coach. If you're going to do that really well, you need someone
yeah,
like Julie who is going to support you through it because it can be super overwhelming.
it can be. And then people tend to get stuck
Hmm.
in the elimination phase. We forget it's a phase, right? Like we're talking about, like, trimesters
Yeah,
and
yeah.
growing a human time frame. And we're not supposed to be in the elimination phase for the rest of our life.
Hmm.
And so, I love that whole figuring it out. Like it like just drops that inflammation down to a certain level where then you
Yeah,
can really dig in and get to
yeah.
what else is going on.
Yeah, yeah, exactly. Exactly. And it helps to like lower the body burden in some ways so that you can really start sifting through like, oh, when I eliminate these things, then my inflammation is lower and I'm not as reactive to everything, right?
Right.
It
Well,
can
then
it
you
can
can
really like cool it down a
notice,
little. Yeah.
and you can notice, if you're reacting to 20 things
Yeah.
all the time. I joke, I know most listeners aren't old enough, but I think of it as like that fuzzy TV screen, when the antenna wasn't right when I was a kid,
Mm.
as far as like it's just your body's being bombarded by too
Yeah.
many sources of inflammation. And
Yeah.
so if you can start to get some of them lower, then you can really hear the signals.
Yeah, yeah, absolutely. And then I think the other thing with autoimmune conditions, specifically from the relationship to fertility, is around toxins
Yes,
and
you read
mold,
my
right?
mind.
Yeah. So those are the other big ones that we want to make sure like you don't have a huge toxin burden because that is going to make it much more likely that your immune system is overreacting to things that it shouldn't be reacting to. So that's important. And then, like, we've seen this relatively often, like, mold comes up frequently. I'm sure you see that a lot too. And that is also, in some ways, that's just like your immune system trying to fight off whatever this external stimuli is, and then going haywire and being like, oops, sorry, I didn't realize your thyroid shouldn't be the thing I attack.
Or your embryo, or
Yes, or your
yeah, because
embryo,
if the
or
body is in fight mode, I love, and we're speaking because this is my podcast, we're talking about autoimmunity specifically. But I have a client who I just started working with a few weeks ago. She is getting married and knows they want to conceive right away.
Mhm.
And she's healthy. She just found functional medicine, so she's up leveling. And sure enough, so these are things that to us are so common with autoimmunity. But I'm guessing when it comes to toxins, everybody considering conceiving or getting ready to conceive, that needs to really be on their radar as well,
Yeah.
because if you're living on this planet, chances are pretty good you're holding on to some toxins.
Yeah, and you like we're exposed to, I think, so I had interviewed this awesome doctor on my podcast. Can't remember her name, but she's from Canada. And she was like, we're exposed to 80,000 toxins on very low levels every single day.
Yeah.
80,000. I was
And
like, are
they're
you serious?
cumulative.
Like,
Like that's what
so
people don't
much more.
understand is, like you mentioned body burden, and that's what it is. So you may not have some extreme level of one particular toxin,
Yeah.
but to the body, it's still, there's a cumulative effect.
Yes, yes. And it's really like with fertility, the body is if the body is in survival mode, it's not thriving. If you're not thriving, guess what? The quickest, easiest, simplest thing to turn off is reproduction.
Mhm.
It's not a necessity for your survival. It's necessary for the survival of the human race, but it's not necessary for you to continue to exist on this planet. So the body says, I have too much to deal with, turn that off. Like that's not a necessary function. And it's like as simple as light switch off. I don't want to deal. And it can
I don't
like
have the
maintain.
resources
Right,
to do that.
totally.
Yeah. So I
So
have to, that was like the perfect segue. I wasn't even planning
yes.
on it, but we have to go there now. Um, survival mode, I think of
Yeah,
chronic stress, right? Yes,
yeah,
it's so easy to, we've got food, we've got toxins, and they're all important. But what do you say about managing stress or evaluating stressors,
yeah. That's a good
self-care?
point. So I think we have to view the things that we've been talking about are stressors in the body, right?
Right.
So metabolic stressors or internal stressors that have to do with our immune system, the liver not functioning, the toxins that we're exposed to, the food that we ate, like all of those are to a certain degree a stressor. And then we have the external stressors, quote unquote, that are our boss that we don't like, or the job that's super high pressure, or the relationship that's strained for whatever reason. And those are all going to be stressors in a different way, but still impacting our adrenals, which then impacts everything else in the body. So, at the core of it, like supporting the cortisol and melatonin pathways are going to support healing the body on a fundamental level and are going to make you more stress resilient, which is a fancy way of saying like you're not necessarily getting rid of all of the stress because
We
most of it
can't.
isn't going anywhere.
Yeah.
Right? Like your body's still like you're still breathing the air in that you breathe in. But if you can lower the burden, the total toxin burden on all levels, and if you can build in some extra stress resilience, now your body has the capability to say, hey, I can shift from survival into thriving, and I'm okay to turn this reproductive switch back on. So we really have to get to that point of like all the other stuff is taken care of, and the body, and honestly, we're saying body because we're focusing on women, but it's just as important for the male partner, if you have a partner, to both of you really get to this place of everything else is pro thriving.
I like that,
I
pro
don't know
thriving.
exactly what to call
Yeah.
it, but it's like there isn't a signal in your body that's like saying, oh my God, if I do this one thing, I'm going to freak out, or I'm going to die, essentially.
Right. Which is
Is
the signal. I always say like there is no stress response system that's different for, I'm late for this appointment versus like there's a tiger on my rear end. Like internally you get that same response no
yes,
matter what.
yes, exactly,
Is there
exactly.
is there something you like couples to do? Well, because I'm thinking as we're talking about this, like even if somebody is doing all the work and has checked all the boxes, if they're already in a cycle of fertility struggles, that's such a big stressor.
Yeah.
And I remember
Stress, yeah. The
back when
fertility
I
stress
was
is,
trying to have a
yeah.
baby and the doctors would say, just relax, it'll happen. And it's like, well, it's so
And you
easy for
want to
you to
punch that
say.
person.
Yes.
You totally want to punch the person that's telling
Yeah.
you to just
So that's an
relax.
extra level of chronic stress that somebody is needing to manage. And I love that you pointed out. It's really about building resilience. It's the same thing with all like resilience to all of it, right?
Yeah.
Reducing the burden enough to get that resilience, because I have yet to find anybody who successfully lives in a bubble, on an
Yeah.
island.
Totally
Or,
stress
yeah,
free.
yeah. So, but do you have like a starting point for people or something for people to consider, if they're already in that, because it can be intense
Mm,
trying to start
mm.
a family.
Yeah. So I think my advice to a lot of couples is do the testing up front, right? A lot of
That.
times doctors are like, well, you're under the age of 35. You can try for 12 months unsuccessfully before we will test your hormones. and sperm. And sperm often waits for like 2 years sometimes. Like, oh, you're fine. You're only 30. I'm like, I've seen 25-year-old men with super crappy sperm.
Especially
So
these days.
yeah, so like age has barely anything
Yeah.
to do with it. So my
And
advice,
sorry, go ahead.
yeah, so my advice is really to do that testing up front. Maybe you give it like 2 months of trying and you're like, okay, like let's just test and know. And when you know, you have more power to do something about it.
Yes.
And it doesn't mean you have something wrong. Like a lot of times people are like, I don't want to test because I don't want to know if something's wrong with me. And I'm like, well, so then you'd rather wait for an entire year where you're constantly on this roller coaster of, am I pregnant? Crap, I'm not pregnant again. And you go through that cycle over and over again,
It's brutal.
only to be like, I don't know what I'm doing. And you're still gonna, at that point, gonna
End up
need to test
testing.
anyway.
Yeah. And
So
like
save
you said,
yourself.
that knowledge is power, because it's most of what the tests are going to turn up are things you can do something about.
Yeah.
And that just brings up the healthcare system. The traditional healthcare system really hasn't changed since all those myths. I know somebody who's young who miscarried last week. And when she went to the doctor, they said, well, we're not going to do any testing until you have your third miscarriage.
Yeah. Oh, yeah. I'm like,
I'm
who wants to
sorry.
wait for
What?
3 miscarriages?
That's
Yes.
horrible.
Yeah, it's hard. It's awful. It's awful. And
It's
I
like,
think that it's really like it's it's hard to be in multiple ways in this, right? Like as the client that's going through this process and they're going to their doctor and the doctor is like, "Oh no, you're fine. You can do this testing later." And then you're like, "Okay, I guess that's normal and I should like stop worrying about it and maybe it's okay that I have 3 miscarriages." But your body is every single time you have a loss, it's going into survival mode,
right.
right? It's literally like, oh my God, I'm dying. And that degree of stress is going to make another loss that much more likely. So if we're not healing in between, like you have a loss, fine, it happened once. Let's figure out why it happened. And yes, there are lots of reasons why miscarriages happen. And like, I'm just like, don't believe your doctors. Don't believe them.
I got so angry when I heard that last week. I was like, you've
Yeah.
got to be kidding me. Like,
Yeah. Yeah,
no.
it's really common. And like I was just talking to a colleague of mine who is trained as a naturopathic doctor. She's really smart and she had a miscarriage. She went to the doctor. Her OB was like, "Oh, no worries. Just try again. It'll be fine. Just give it 2 months and then you'll be fine." And sure enough, she's pregnant again. And I was like, crap, like you didn't
You're not
think to
doing anything
pause and
different.
do any testing. And she's one of my really good friends. I hope it works out for her. But I'm
Yeah.
also like, this is the problem with our system and it's so global. And unless you're in this field where you're like, wait, I'm going to think about this differently,
Right.
even for yourself, it is so traumatic to be like, yeah, let's just try again and hopefully it's fine. And honestly, like she's 40. She doesn't have time to try again if this is another situation.
Right.
So
Right.
I'm knocking on wood, like not wishing this upon her at all.
Sure.
But it's just an example of like even the most knowledgeable, skilled people are being given this message of like, it's okay, just try again. And to me, if I were to go through that, I would really just be like, that's not good enough. Like,
Yeah.
I don't want to go through this again. It's painful, it's emotionally draining, and it's just bad medicine. Like, it's completely disgraceful that we even have the nerve to tell women to go through 3 miscarriages before they do something about it.
Yeah.
And the level of testing that they
is,
do
yeah.
is like still the tip of the iceberg. And it accounts only for like 10% of the losses. So the other 90%, they're going to say, sorry, unexplained miscarriage. And there are still tests that they should be doing for that other 90% that never get done. So sorry, I went on a rant.
No, don't be sorry. Can you share with us some of those tests,
Yes,
things that
so
people could be asking for, looking
totally.
for?
I think looking for autoimmune conditions should be at the
Mhm.
top of the list, right? So we're doing these like super heavy duty genetic tests before doing the basics, which is
Yes.
autoimmune. Like just test ANA. It's like a $15 test. Anti-nuclear antibodies, that's a very global marker for autoimmune conditions. It's almost always going to be elevated if you have some sort of autoimmune. And you don't need to know exactly which autoimmune it is. If you know that it's autoimmune, then you can like work deeper on that.
Can you say
So
that again? I love
yes, if ANA, anti-nuclear antibodies, come out positive, then you have some autoimmune condition. You don't, at that point, you may not know exactly which one.
and
However,
it doesn't matter.
it doesn't matter. It's like autoimmune is autoimmune, and you're going to
Yes.
approach it the same way, regardless of which autoimmune it is. Granted, you might want to know, you might want to be like, actually, I have these joint pains, and it might help me to know that I have rheumatoid arthritis, not
Right,
lupus.
right.
But at the end of the day, the protocol, the approach to healing it in your body is going to be pretty identical, regardless of what it is. So ANA, like kind of the tip of the iceberg, the simplest, easiest, cheapest test that you can get is not happening as part of the recurrent pregnancy loss list of tests. So that's number 1. Number 2 is testing the guys. So DNA fragmentation on the guys. And what we do in our practice is something called homocysteine, inflammation markers, CRP, etc., and blood sugar and insulin. And those, believe it or not, have been connected to pregnancy loss. So what they have found, and this is a crazy wild story, because the whole time I've been working in fertility, pregnancy loss has always been a big percentage of it. And I love it because I hate the idea that anyone goes through this more than once.
Right.
So we were testing all of the guys on all of these markers. And I noticed very early on, I was like, wait, almost every single guy that we test with a partner who has had a loss has either high homocysteine or high blood sugar levels or high insulin.
I have goosebumps.
And
like, why don't people know this?
Even there are like hundreds of doctors that I tell this to, and they're like, what? You just blew my mind. And so for years, I was like, I swear I'm crazy, but this is a pattern. Like, I swear this is a pattern. And 2 years ago, I started seeing the studies coming out saying the exact same thing. Homocysteine and blood sugar are connected in the male to pregnancy loss in the female. And what's exciting about that is because A, it's really super easy to fix.
Yeah.
But B, it's the male partner, and most of these guys have really great sperm. So it's never caught on a sperm test. Never, ever, ever does it show up as like, oh, your sperm are not so great. Maybe we should do something about it. No, these markers are completely independent, yet it is impacting the outcome of the pregnancy. And there are studies on that show that it's impacting the outcome of the pregnancy.
Well, and even beyond that, if you think about once they have, a healthy pregnancy that results in a baby, these guys are going to be so much healthier long term because A, like you said, these are easy things to fix once you know they're there. And they're so important. I mean,
Yeah.
you don't want high homocysteine, and you
Yeah.
certainly don't want high blood sugar, which
Sugar.
is way too common these
Oh my
days.
goodness. And the number of times guys are, and I'm like, I've repeatedly told guys like, oh, you're borderline diabetic. Did your doctor talk to you about that? They're
No.
like, no. What are you talking about? I'm not pre-diabetic. I'm like, well, first of all, you have all this abdominal weight. We're gonna need to do something about that. But second of all, like, here's your lab test. It says right on the lab, like, you're pre-diabetic, right?
Here's your A1C right there.
Yes, exactly. So we're gonna need to do something about it. And a majority of the time, we had one guy, the woman has PCOS, so inherently she had some things leading into the issue. But they've been on this journey for 3 years, 3 miscarriages, no, like, never been tested for anything outside of her hormones, and like, oh,
Sure.
you're not getting pregnant because it's PCOS.
Right.
The guy comes in and I'm like, this dude is like 30 pounds overweight. And
Sure, he's
I'm like,
estrogen
sure,
dominant.
yeah, it's sure he's got blood sugar issues. He doesn't have enough testosterone, like all these things, right? And I'm like, oh, this is gonna be awesome. So within
Like
a
cheating
month,
for you.
yeah, I'm like, oh, yes, we want to work on her PCOS, but we really need to work over here and get him to the point where he feels amazing. And the funniest part was we worked with him for a couple of months. He lost like 45 pounds in 3 months or something like that.
Wow.
And we essentially didn't do anything except eat healthier, right? Like, there was no diet, there was no like massive change. It was just like, here's the guidelines, eat anything you like on this guideline.
Real food. Eat some real food.
Yeah. And his blood sugar levels went down, his homocysteine went down, and the best part was, so I didn't tell you, but I couldn't actually stay erect.
So that'll
that's
also make
all
it harder to conceive.
fixed. Like, never told, like, hasn't talked about
Wasn't
it. It
discussed.
wasn't like a thing.
Yeah.
But he's like, oh yeah, that fixed itself. And I was like, what? That's amazing. So it's, I feel like I'm getting super excited because I feel like the male part of this is so ignored, but the minute you start paying attention to it, massively different outcomes. They got pregnant in 4 months. They're in their like later part of their second trimester. So they're doing really, really well. They're past like every miscarriage she's ever had.
Amazing.
And they got pregnant in 4 months. It's
Amazing.
like, it doesn't have to take forever, right? It's like, when you do the things that can click into place quickly, it doesn't have to take a year. It doesn't even have to take 6 months. It can be super fast, efficient, but also like
Effective.
Going to increase the outcome of you having a healthy baby.
Which is so amazing. And what I love the most about this conversation is, yes, the gift of helping people have families, but really, this is actual, truly preventative medicine.
I agree. This is why I got into this. It's totally why I got into this. So I didn't know it when I was going through my fertility questions, but my mom had passed away from cancer, and I had done all this research and study and training, honestly, in cancer therapy. And I thought I was going to be a cancer specialist because my mom had been through it.
Right.
And I realized that what I was really passionate about is like, how do we prevent all of it? So when all the fertility stuff came up, and like at some point I started crying because I couldn't have put all of those things together better.
Right.
But it was a big part of just like, couldn't we have a healthier planet and healthier children and healthier families, that these guys no longer are pre-diabetic and they now have a longer lifespan, a healthier lifespan, just from going through fertility issues.
And then that means the whole family is going to be eating real food, and the whole family is going to be aware of toxins, and the whole family And that's how
Yeah.
we get to the healthier planet. That's always my most exciting part. It's the trickle down. It's that butterfly effect.
Yeah,
And
absolutely.
so
I love
you're
that part.
starting out like, these kiddos aren't going to have to course correct. These families are just on the
Yeah.
right path,
Yeah.
which
And
is
and I tell them all the
amazing.
time, I'm like, please keep doing this after you have your child.
Right.
Like,
Don't forget. Like,
yeah,
yeah.
don't, it's really easy to get like, oh, we're busy. Oh, the stress of like having a new child. But I think sustaining as much as you can, or even like weaving in as many of these lifestyle things as you can continue doing, you're
Yes.
going to have a healthier life because of it.
Yeah. And because we talk off air about, it's a process, right? Like I'm still working on it. You're still working on it. Like it is,
Always a work in
it
progress.
is, it's a process. Well,
Yeah.
clearly the universe had intentions for you and your gifts. And I'm so grateful that, I can only imagine. I wish when I was wanting to start my family and struggling, that I had you, but you weren't doing this yet back
No,
then because
I
I'm older
was
than
not.
you.
I
So, but
was
it is,
not.
it is such a gift to everybody and to the future.
Thank you.
And I'm so grateful that you joined us today to share some of your sunshine and light and knowledge with us is amazing. So what is one step that listeners can take today? And we just were talking about, yes, this was about fertility, right?
Mm,
But
mhm,
anybody, whether you're like me and you are way past having your children,
mm.
what's one thing people can do today to start to improve their health?
I think I think the lowest hanging fruit is lowering the toxin burden, right? And I think that that can happen in a lot of subtle ways. So that is a really good starting point. And we didn't get into like all the toxins that are in the environment. So I'm happy to share with all of your listeners the Divas Detox Guide, which is basically a PDF I created to like walk them through every part of their house to detox all the stuff that affects fertility.
I love that. And I don't think it's out yet, but this is what we talk about together on your podcast as
Yes.
well.
Yeah, we've
So
talked about it.
if
Yeah.
you want to do a deeper dive with both of us on
Yep.
toxins.
Yep. Actually, we could, I don't, we can coordinate. We can link my
Yeah,
podcast to
we'll flip
yours
them.
if you want to do back and
That would be
forth, because
great.
I feel like we talked so much about the toxins that are affecting fertility,
Yes.
and it would be really great for people to be able to hear that because it's just like we didn't get into it.
Yeah.
And there's other content out there. So
I love it. And we'll link to the
yeah,
guide
we can do that.
what a great gift. And I love that you were like clear about like the smallest steps we can take. Because again, it's a process. And so
Hmm.
it can be
Yeah.
overwhelming if you think, oh my gosh, I need to be totally again, can't achieve toxin free if you're living on the planet. So just taking those small, I'll even add imperfect steps, still really do move that needle.
Yep.
So I love
Progress
it.
over perfection. Love
Yes.
that.
So before we wrap up, for people listening on the go that aren't
Mhm.
going to check the show notes, where's the best place for them to find you?
On Instagram at Holistic Fertility Doctor, there's like tons and tons of content on there, and you're welcome to DM me if you're like, hey, you said this thing, I have a question, whatever. We're very much active on Instagram.
And Dr. Aumatma she is just the kindest, most generous soul. So really hit her up if you have questions. And if you are listening to this and you are in that place where you are getting ready to start a family, seriously connect with her. She is amazing and she helps so many people reach that dream.
Thank you. Thanks so much for having me and letting me share this message. I know that, gosh, like the things that you support people with, the fertility, there's just so many pieces that I feel like connecting the dots and like having us all working together to achieve this like vision that we all have for a healthier planet It's happening. It will happen.
This is why we have these conversations. Absolutely. So,
Absolutely.
Aumatma,
All
thank
right.
you so
Thank
much.
you.
You've shared amazing gold with us today.
Thank you.
For everyone listening, remember you can get the show notes and transcripts by visiting inspiredliving.show. I hope you had a great time and enjoyed this episode as much as I did. I'll see you next week.
Thank you for listening to Julie Michelson's Inspired Living with Autoimmunity. Did you enjoy this episode? Please like, share, and subscribe wherever you listen to podcasts. If you'd like to get a transcript of this and every other episode, just head on over to inspiredliving.show or click on the link in this episode's description. There, you can also find everything we discussed in this episode, including links and information about our guest. You can even send in your questions to be answered by Julie in a future episode. That's inspiredliving.show. Until next time, this is Julie Michelson's Inspired Living with Autoimmunity podcast, helping you take your power back.